For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Today we have Dr. Shannon Haas, a primary care physician from the St. Tammany Physician Network Mandeville office, here to give us a little bit of information about wellness visits, the importance of primary care, and a big deal this year, the flu. Welcome, Dr. Haas.
Hi, well, thank you.
Can you, I guess, first tell me a little bit about your background in medicine?
So I did my residency at Baton Rouge General, and then after that I worked in Mississippi for a year or two. I worked on the South Shore for a good bit, and now I'm working at St. Tammany Physicians Network Mandeville office, where I just started in October.
Okay, well, thank you. So first, can you talk about what a wellness visit is?
So a wellness visit is a visit that it's confusing to patients, but it is a free visit to talk to your doctor about wellness and preventative medicine. And so it's something that started with the Affordable Care Act, and Medicare rolled it out first in 2011, and then after that all insurance companies that are in the marketplace offer a wellness visit to their insured. So the wellness visit is a visit where you don't pay a copay, you don't pay a deductible, you get face-to-face time with your doctor, and the things that are talked about are preventative medicine and wellness things like vaccinations, screenings, and then anything that's unique to that patient's medical history.
Okay. So you mentioned vaccines. What vaccines can be covered in a wellness visit?
The flu vaccine every year, that's one. Tetanus is a vaccine that you get every 10 years or every 5 years if you cut yourself in the kitchen or step on a rusty nail or something like that, hurt yourself in the garage, that's another common one. Then there is, if you're a smoker, you want to get a pneumonia shot. After the age of 65, you want to get a pneumonia shot. And then if you have lung disease, you get a pneumonia shot every 5 years. And then the other ones, there's the shingle shot. That's one that you want to get as well. So the wellness visit is a good place to talk about those things, because if you just see your doctor when you're feeling bad for sick visits, you don't have time to say, well, what can I do to keep myself well?
Okay. You also mentioned screenings. What kind of screenings can you get from
the screening tests that are covered or that we talk about when we have a wellness visit are pap smears for women, mammograms after the age of 40. Then for men, the prostate-specific antigen blood test, that's one that they want to get done after the age of 50 or the age of 40 if they have a family history of prostate cancer. And then the dreaded one, the colonoscopy, that's one we start talking about at the age of 50, sooner if there's a family history. And DEXA scanning is another one that when you get up in age, you want to start looking at your bone density to make sure that you're not developing osteoporosis.
Okay. So I guess, can you talk a little bit more about why a wellness visit is important for patients?
Yeah, so I touched on that a little bit. And it's important because if you only see your physician when you're sick, then there's never really time to talk about preventative things. So maybe if you went in for something that involved your stomach, well, you'd say, okay, well, it's about time for me to get my colonoscopy anyway, let me get it done. But otherwise, if you stay healthy, you might miss something that needs to be done because you don't go in to see your doctor.
Okay. And you also mentioned preventative care. Can that include for like chronic illnesses and things like that?
It can. And so if you have hypothyroidism or diabetes or hypertension and it's well controlled, you can use your wellness visit to get management for that as long as it's under control. When things start to fall off of track, well, then you want to not have a visit where you're talking about wellness and talking about that. You want to just focus on that. But if you have something that you see your doctor for routinely, the wellness visit is a good kind of, I'm going to call it a frugal point in your insurance plan that you can miss a copay or miss a deductible because you can use your wellness visit.
Okay. And speaking of insurance, what insurances offer wellness visits?
Oh, okay. So Medicare was the first to offer it. Medicare offered it in 2011. Then after that, it was mandated that all of the insurance companies that are part of the marketplace. Now, the marketplace is it's a website where you can go to shop for insurances, and that was something that started with the Affordable Care Act. And so that's a place for people that don't have insurance provided by their employer or are not under their parents' plan anymore or something like that, that they can go to shop for insurance plans. But if you're on the marketplace, those insurance companies have to offer a wellness visit to their insureds.
Okay.
And the wellness visit is every 12 months. So if you saw your doctor for a wellness visit on, say, October 1st of 2016, then you could get another wellness visit October 2nd of 2017. And it's a year and a day later.
Okay. And do you find this, in your opinion, do you find that many insurances offered by employers also cover a wellness visit as well?
Yeah, I think that they're starting to get on board with it, yeah.
Okay. And in a wellness visit, is something you can talk about like weight loss and exercise and things like that? Because I feel like that often has a huge effect on people's overall health.
Yeah, so if you have questions about any of the fad diets that are out, or questions about how is it best to lose weight, or what can I do to get the most value out of my exercise program because I only have limited time, then that's a place that you can bring that up with your doctor, yeah.
Okay. And also, can you talk about your primary care physician?
Mm-hmm.
So can you talk about the importance of primary care in general? Because I think that's something a lot of people just say, you know, oh, my stomach hurts, I'm going to go to a gastro doctor, or my head hurts, let me call a neurologist or something. Can you talk about the importance of why having a primary care physician that you know that you go to regularly is important?
Okay, so I'm going to use prostate cancer as a good example for that. So if you are a healthy 60-year-old male and maybe you have high blood pressure and that's it, and you go to your cardiologist for your high blood pressure. So you see your cardiologist, he's got your blood pressure under control, and you go back to him every year, but you don't have a primary care physician, you may never get in the blood work that your cardiologist is doing. Now, if they're good, they might, but they may not order a prostate-specific antigen screening test to screen for prostate cancer. Now, sometimes you can go to a urologist and get this done, but if it never gets done and you have a carcinoma, a prostate cancer brewing, you'd miss it. And cancers are sneaky. They are painless. They don't let you know that they're there until they're really a problem. And so to wait until you feel bad or wait until something happens is not the way to go. So if you see a primary care, they pull it all in, they pull it all together. They say, okay, well, your blood pressure is well controlled, your cardiologist is on board with that. Let's talk about everything else. Let's check your thyroid. Let's check prostate-specific antigen and check for that. Let's make sure you get a colonoscopy so that nothing is brewing under the surface.
Right.
So.
Okay, so more specialists obviously are going to cover what they are specifically there for, and that's so.
But you can't be guaranteed that they're covering everything. And sometimes they do a good job, and they do try to cover everything, but
that's not really what they're there for.
It's not really what they're there for,
Right.
yeah.
And I guess from what I've seen with some people, some diseases can affect other parts of the body, or, you know, like diabetes, for example. If you're, you know, only treating one specific aspect of that.
Or chest pain's a good one because it can be cardiac, it can be pulmonary, it can sometimes be gastrointestinal. Well, do you want to go see, or would it be more efficient to see a cardiologist and then a gastroenterologist and then a pulmonologist? Sometimes if you just do one visit with your primary care, they can kind of pinpoint it. I think this is cardiac in origin, or I think this is gastrointestinal in origin, or I think this is pulmonology in origin, and point you in the right direction so that you're not bouncing all over and wasting time.
Okay, well, thank you, and we'll be right back in a minute.
Okay.
I'd like to thank Dr. Haas for giving us a little bit of information about wellness and well visits, and we'll be right back with her to talk about flu.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We are back with Dr. Shannon Haas to talk a little bit about the flu, which has been a big issue this year. Hi, Dr. Haas.
Hi.
Welcome back. So I guess first, let's talk about the flu vaccine. Why is the vaccine not always effective? I think that's something we hear a lot.
I get a question about that a lot. Why does the CDC make us get it every year? Why do they want us to get it every year? And then they miss it. So the flu, influenza, the virus, it's smart. It's a really smart virus, and it rebuilds itself constantly. Every year from October of one year to October of the next year, it's an entirely new virus. It has remade itself. Different from bacteria that are the same bacteria, they stay the same. So what CDC does is it'll study the vaccine and it tries to learn it as best as it can. And when it does that, then they start building their vaccine based on what they know about it at some point in time. So let's say that for this 2017-2018 flu season, that they began studying the virus maybe in the fall of 2016, it changed and changed and changed, and they tracked it and kept with it. But at some point, they have to make the virus and get it out to consumers or get it out to the public. So maybe around August, they'll stop studying it and they'll take the information that they know about it and they make the vaccine and they get it out to clinics in around October. If the virus changes from August to October, they can't do anything about that. And a lot of times that's what happens. And so this year, I think that the vaccine is only 33% or so effective. I'm finding that more people have strain A. If they've gotten a flu shot, they're still catching strain A. There's a strain A and there's a strain B. And so probably strain B just didn't really change much after CDC made their vaccine, but strain A did. And it changed 60% before we were able to get a vaccine, or 60% after CDC made their vaccine. So that's why the vaccine in some years seems more effective than in other years, because every year is different. Every year it's a different bug. Every year they have to make a new vaccine, and there's that little window of opportunity for the bug to change even after they've made the vaccine.
Okay. So I guess based on that, why is it still important that people get the vaccine? Because I think people don't want to get it because they're like, it's not going to be effective, but...
For two reasons. Historically, they do a good job of getting the vaccine to match the bug. And so some years they're off, but most years it covers the flu and it does a good job of it. And the other reason is because I find that the people that get the flu, even after having gotten the vaccine, don't look anywhere near as beat up as the people that get the flu and didn't get the vaccine. It does prepare your immune system to fight the flu better.
Okay. And you mentioned historically it's done a good job. Can you talk a little bit about the effectiveness historically?
So from 2010, the effectiveness is 70%.
Oh, wow.
That's pretty good. And so this year, it was 33%. 2014 was a bad year. 2009 is off the charts. But after 2018, 70%, if you had a 70% chance to miss the flu, that's pretty good odds, I think.
Right.
So.
Okay. And I guess now, can you tell us, like, what is the flu? Because I think we hear about it, everyone's like, oh, this person got the flu. What is it?
So the flu is a virus. It's the influenza virus. It's not a bacteria, it's not treated with antibiotics, although we can talk about that later. Sometimes you might get prescribed antibiotics when you are diagnosed with the flu, but it's a virus. It gives multiple vague symptoms. It can be headache, it can be nausea, it can be upper respiratory type things like cough, cold, runny nose, or it can be stomach upset. My stomach hurts, diarrhea, nausea with or without vomiting. So it's a broad range of symptoms that this one little smart virus can do.
Okay, and what is it treatable? What would you do if you have the
Yeah,
flu?
so it wasn't always treatable. It used to be, you got the flu, sorry, go home and feel bad. Now we have this medicine that's out, it's called Tamiflu, and it's an antiviral medicine, and it shortens the duration of the flu virus. And so the flu, it lives in respiratory droplets, and once it infects, it thrives in your system. And it can last 7 to 10 days thriving in your system. If you're lucky, maybe 5. But if you can get diagnosed with the flu in the first 48 hours of having symptoms, Tamiflu is something that will shorten the course of the virus. Meaning, okay, so I've got the flu, there's a bug in me, it's living in me, and it's flourishing. It's going from 1 bug to 2 bugs to 4 bugs to 8 bugs. Well, Tamiflu steps in and it says, ooh, you're 8 now. You're not going to become 16 and you're not going to become 32. And so your body can take that number of flu and start getting better faster. So in that way it shortens the duration of feeling bad.
Okay. You mentioned antibiotics. I know that's something we've talked about in the past that get overprescribed a lot, and a lot of people just have a sniffle and they're like, give me some antibiotics, but they usually aren't to treat viruses, but you mentioned that they may in the case of the flu.
In this case, yeah. So, it goes from one spectrum to another, where people say, I feel a hiccup, I want antibiotics for that. And then there are other people that are, I don't want to take antibiotics for anything. And then there's good balance in between. To bring it back to the flu is a good kind of point, because sometimes you might be prescribed an antibiotic even though you're diagnosed with the flu, which is a virus, and people say, well, and I see this all the time, they come back to the clinic and they have bronchitis after the flu or pneumonia after the flu. And I say, well, gosh, when you got diagnosed with the flu, did they give you anything to take? Well, yeah, they gave me a Z-Pak, but I didn't take it because this is a virus. And it's like, okay, well, maybe they heard something that said, ooh, I think that they might be suspect to a bacterial infection on top of this viral infection. So at baseline, we're all great. We get something like the flu, we get a virus, our immune system is weakened, and we become subject to secondary bacterial infections. And so for that reason, if your doctor prescribes you an antibiotic, even though they're diagnosing you with a virus, take the antibiotic, because it means that they heard or saw something that suspects them that you're more vulnerable to getting a secondary bacterial infection, and they're maybe trying to prevent it. So.
Okay. And you mentioned earlier about getting diagnosed quickly. What is the diagnosis process for the flu?
Oh yeah, so that's a fun one. It's a nasal swab. They take a Q-tip and I have a nurse that says she collects boogers. They collect boogers, and that's the test for it. It's not the most pleasant thing, but it's not terrible either.
Okay, is it something that y'all test in the office so you know immediately, or do you have to go home and wait for results? Or?
No, we have a test that you know within 10 minutes.
Okay.
Yeah.
And we already talked about symptoms, but something that people have been mentioning this year, and I've heard in past years when the vaccine isn't as reliable, is the deadly flu.
Yeah,
Can you talk a little bit about that and that kind of fear that people have?
Yeah, because that goes back to those secondary bacterial infections. Flu in itself is not deadly. It's inconvenient, it's uncomfortable, no one wants to get it, and it's very contagious. But it's when the flu weakens your immune system and weakens your system to more significant bacterial infections, and the really scary ones are the pneumonias. So a lot of times when we hear about a deadly flu, it means it is a strong flu that sets you up for secondary bacterial infections, usually of the lungs. Most people, when they die of the flu, they die of pneumonia. And the important thing about that is, if you have the flu, number one, stay home, don't infect others, right? And then number two, take good care of yourself. And I'll add on that, number three is, if you feel like you're getting worse, don't be embarrassed to go to the doctor. Sometimes people stay home because they say, well, I've got the flu and I feel bad, but I'm supposed to feel bad. And that's when they get sicker and sicker and sicker. And then when they do come in, it's a full-blown pneumonia, and it's tougher to handle.
Okay. And I guess you mentioned pneumonia a lot. Can you just kind of give a quick of what pneumonia is?
Yeah, so pneumonia is, it can be viral, but it's usually a bacterial infection of the lungs. And I'm going to talk about staph pneumonia. Staph pneumonia is the one that most commonly follows the flu virus. If you think of staph and abscesses that you get in your skin, like that need to be drained, those can happen in your lungs. And so it's hard to breathe, it's hard to get oxygen past something that could be an abscess in the lungs. And unlike your skin where it has room to get out and make space, in your lungs it's a compartment, and there's only so much space in there. And once that abscess or that infection takes a part of the lung and pushes, it's pushing into lung tissue, and it's damaging lung tissue. There's no place for it to get away from it. And so it can be really destructive. It can make you really sick.
Okay. Well, thank you so much.
You're welcome.
I'd like to thank Dr. Haas for being here today and giving us that great information on primary care as well as the flu. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.